Hi class, welcome to the Care of the Child with a Respiratory Disease. This course, Care of the Child with a Respiratory Illness, will be part of the BSN nursing program offered to students in the junior year of the spring semester. This unit of instruction will focus on the respiratory diseases experienced by the pediatric patient. There are many respiratory diseases that the pediatric patient experiences. These include the following: croup, acute bronchiolitis, respiratory syncytial virus or RSV, bacterial pneumonia, cystic fibrosis, and asthma. The first respiratory disease that we're going to talk about is croup. Croup occurs in younger children anywhere from 6 months to 3 years. It's an infection of the upper airway which obstructs breathing and causes a characteristic barking cough. This cough is the result of the swelling of the larynx, the windpipe, and the bronchi. When a cough forces air through this narrow passageway, the swollen vocal cords produce a noise similar to a seal barking. Taking a breath produces a high-pitched whistling sound. Some symptoms that the child with croup experiences are upper respiratory symptoms for 1 to 3 days, low-grade fever, barking cough, hoarseness, inspiratory stridor that's worse at night. Children prefer to sit up because it's easier to breathe and is aggravated by agitation and crying. If symptoms last longer than 3 to 5 days, the parent is usually instructed to seek the pediatrician. Also, to call the pediatrician if the child makes noisy, high-pitched breathing sounds when inhaling and exhaling, when high-pitched breathing sounds are made without crying or agitation, drooling or difficulty swallowing, if the child is struggling to breathe, or develops blue or grayish skin around the nose, the mouth, and the fingernails. Prevention of croup is frequent hand washing and staying away from sickness. The treatment of croup is comfort, steroids to decrease the inflamed airway, epinephrine to decrease airway inflammation, keeping the child calm, cool air, and of course fluids. The next illness that we're going to talk about is the respiratory syncytial virus. The respiratory syncytial virus causes mild cold-like symptoms in older children and can cause serious problems in young babies, including pneumonia. The symptoms that children experience are fever, stuffy nose, cough, trouble breathing, decreased interest in their surroundings, listlessness, irritability, poor appetite, and apnea. Respiratory syncytial virus is usually caused by a virus that causes an intense inflammatory response. Some additional symptoms that babies may experience are they refuse to breastfeed or bottle feed, they're usually very upset and inactive, they have trouble breathing or shortness of breath, and they can produce a productive cough of yellow, green, or gray mucus. Simple steps for preventing RSV is good hand washing, keeping their toys, blankets, and sheets clean, avoiding crowds and other children during RSV season, which is anywhere from early fall, September, October through April, no smoking, and staying clear of people who are sick. Treatment of RSV is generally supportive treatment, fluids, oxygen, and antipyretics. There's no data to support steroids or bronchodilators, and they may be given ribavirin. The next topic we're going to talk about is bronchiolitis. Bronchiolitis is a disorder most commonly caused in infants by viral lower respiratory tract infection. It's the most common lower respiratory infection in children anywhere from 1 month to 2 years of age. It is characterized by acute inflammation, edema and necrosis of epithelial cells lining the small airways, increased mucus production, and bronchospasm. In bronchiolitis, the bronchi and the bronchioles become plugged with mucus, causing air to be trapped in the lungs. The child can breathe air in, but has difficulty expelling it, which hinders gas exchange. Some symptoms of bronchiolitis are runny nose, congestion, cough, low-grade fever, difficulty breathing, wheezing, and otitis media. This is just an overview of the pathophysiology of bronchiolitis. The treatment of bronchiolitis can include oxygen, high humidity using a mist tent, rest, fluids, of course, and the child might require blood gas monitoring depending on how severe it is. Our next topic is pneumonia. Pneumonia is an inflammation of the lungs caused by bacterial viruses or chemical irritants, and is a serious inflammation in which the air sacs fill with pus or other liquid. Bacterial pneumonia is caused by Streptococcus. It can be caused by group B Streptococcus, Staphylococcus aureus, or Group A Streptococcus. Some symptoms of pneumonia can be a productive cough, pain in the chest, vomiting, diarrhea, decreased appetite, fatigue, fever, stomach pain, chills, breathing fast or hard, headache, and fussiness. Diagnosis of pneumonia can be through a history and physical exam, chest x-ray, blood tests, sputum culture, pulse oximetry, chest CT, bronchoscopy, and pleural fluid culture. The treatment of pneumonia is oxygen and antimicrobials, ampicillin, gentamicin, or ampicillin, or broad-spectrum antibiotics for nosocomial bacteria. In addition, the child may have supportive treatment such as increased fluid intakes, cool mist humidifier, Tylenol for fever, cough medication, nebulizer treatments. Cystic fibrosis is most common in serious genetic disease in Caucasians and is a chronic condition that affects the lungs and digestive system of the body. Children with CF or cystic fibrosis may have chronic lung infections or poor digestion of their foods. 1 in 25 Caucasians is a carrier. Diagnosis of cystic fibrosis is through a sweat test. A mild electrical current pushes medicine into the skin to cause swelling. Sweat is collected and the salt content is measured. Cystic fibrosis is usually diagnosed in early childhood. The pathophysiology of cystic fibrosis is cystic fibrosis becomes present when there's a defective gene related to a protein that is involved in chloride ion transplant. Patients with CF usually develop unusual thick, sticky mucus plugging that clogs the lungs and causes obstruction, which leads to life-threatening life infections and also obstruction in the pancreas. Cystic fibrosis can cause increased wheezing and increased attacks of bronchitis and pneumonia. In later years, increasing shortness of breath and fatigue. 85% of children with cystic fibrosis have trouble digesting their food and experience large, frequent, greasy, foul-smelling stools. Cystic fibrosis children generally are very small on the growth chart, which can alert healthcare providers that there is a problem. Currently, there is no cure for cystic fibrosis. The treatment is usually just antibiotics when they have an infection. PD&C, children are given pancreatic enzymes before their meals and medications to loosen lung secretions. The average age of survival for cystic fibrosis is 37 years. A child may have a lung transplant when they are older, or when they would be qualified for it, but the lung transplant does not cure cystic fibrosis. Some symptoms of cystic fibrosis are persistent cough with productive thick mucus, wheezing and shortness of breath, frequent chest infections, sinusitis, nasal polyps, digestive symptoms, bowel disturbances, weight loss, obstruction, constipation, osteoporosis, and arthritis. The treatment: any child with cystic fibrosis has a diet that's increasing calories and increasing protein. Chest physiotherapy, breathing exercises, medications, vitamins, bronchodilators, pancreatic enzymes. And this is just an overview of the picture of cystic fibrosis. It gives you the definition and the causes, the risk, diagnosis, everything that we covered already. Our last disease that we're going to talk about today is asthma. Asthma is a spasm of the bronchial tubes caused by hypersensitivity of the airways in the bronchial system and inflammation that leads to mucosal edema. It's also referred to as reactive airway disease. Asthma attacks are triggered by hypersensitive response to allergens. Asthma triggers include allergens, pollen, dust, pets, upper respiratory infections, colds or flu, inhaled irritants, secondhand smoke. Certain weather conditions, cold air, can trigger asthma for some people, exercise, and emotions. Asthma can be intermittent or can be extended periods or chronic. Some clinical signs and symptoms of asthma are difficulty breathing, shortness of breath, sleeplessness, wheezing, chest pain, cough after exercise, and chronic cough. Here are some additional causes of asthma or trigger cigarette smoking, medications. Certain medications can trigger certain children with asthma. Fluids, smoke, pollution. The treatment of asthma is usually bronchodilators. It's important to recognize the symptoms, flow meters, eliminating allergens, bronchodilators, steroids, nebulizer treatments, and chest PT. This concludes my overview of the care of the child with a respiratory illness.